Welcome everyone. Thank you very much for joining us today for BLM2 ICAM4 conference. My name is Shafak Say. I'm a Master of Sciences in Occupational Therapy, and I would like to share our latest research project on the effect of online cognitive behavioral therapy on depressive symptoms in recovered patients with COVID-19. COVID-19 virus is on the rise globally, and people with the disease experience a variety of physical and mental problems. According to studies, depression can be a complication of the virus. So far, limited measures have been taken to prevent and treat emotional psychological complications of COVID-19. The aim of this study was to evaluate the effect of online cognitive behavioral therapy on depressive symptoms in recovered patients with COVID-19. This study was conducted in a quasi-experimental design. A sample of 150 recovered patients with COVID-19 who were referred to Imam Riza Hospital in Tabriz City were selected by random sampling method. The patient's emotional psychological status was assessed by the Beck Depression Inventory, and they entered the treatment process according to the inclusion criteria. As a therapeutic intervention, a scientific and valid approach called CBT was implemented, which 2 occupational therapists performed in 8 treatment sessions in the context of a social communication application. PET sample t-test was used to analyze the time sequence of quantitative data due to its normality. In this presentation, I will briefly review the generalities of these 8 treatment sessions. The first 4 sessions of treatment were behavioral activation, and the last 4 sessions were cognitive intervention. Session 1. The first step of intervention included teaching patients how to monitor themselves to evaluate their level of activities. Session 2. After the first stage, patients were required to monitor mood changes during planned activities. This experiment tests the patient's incorrect predictions about success or failure and evaluates the effect of the activity on the patient's mood. Session 3. In this session, misconceptions were identified, and based on them, the amount and type of activities were increased. Session 4. Behavioral activation also targets skills deficits. In this way, patients who lacked strong communication or showed poor social skills were placed in complex social interactions. Session 5. The process of recognizing automatic thoughts. During mood swings, the patient was instructed to ask, "What is going through my mind?" Session 6. When the patient gained the ability to recognize automatic thoughts quickly, the next step involved logical analysis to understand whether these thoughts were true, somewhat true, or untrue. Session 7. When the patient could change automatic thoughts with a bit of skill, the therapist shifted his or her attention to unraveling rules, beliefs, and assumptions that made the patient susceptible to negative thinking and life events. In Session 8, in this session, the therapist constantly provided written material and summarized what the patient had learned during treatment. After the last session of the intervention, the effect of this therapeutic approach on reducing the depressive symptoms of patients was evaluated. According to the findings, the Beck score of the participants decreased significantly after the intervention. According to the results of this study, it seems that online CBT or online cognitive behavioral therapy significantly reduces the depressive symptoms of patients with improved COVID-19. This study provides meaningful preliminary evidence to support the effectiveness of the online CBT as a non-drug intervention for the mental health problems of patients with COVID-19. Therefore, in order to promote the recovery of patients with COVID-19 and help health authorities to develop preventive measures and effective treatment of emotional psychological problems caused by this virus, it is recommended to use the online CBT approach, hoping to defeat the coronavirus. We thanks for your attention.